Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. It's said that at least 1 out of every 5 Americans suffers from allergies, whether it's food, seasonal, cat and dog allergies. It's no fun. Sneezing and having itching eyes and nasal congestion and wheezing or itchy skin and rashes. Just not fun at all. Express Care's Dr. Jitka Lom joins us in studio to give us advice on how to prevent allergies and how to deal with them. Thanks, Doc, for coming in. So what are allergies? What causes them?
Okay. Well, you know, we have a very wonderful immune system. It's got many parts, and our immune system is there to recognize what's foreign. It can recognize what's self and what's non-self. So if there's something that comes into our environment, specifically a protein or a molecule, for example, pollen, dust, a bee sting, something that comes into our body that's foreign, our immune system will react. And the main way that you're thinking about it right now, and the audience with regards to allergies, is that we release a chemical called histamine in our bloodstream. That's where you hear the antihistamine word, right? So the chemical histamine is within a certain cell in our body that's kind of like roaming around, and when it interacts with one of these allergens, we call them, it will bust open its histamine and the cascade will begin. And the cascade includes swollen eyes and runny nose and itchy skin and all of that. And that's basically a way of flushing that allergen out of our body. So if you have runny eyes, whatever's in your eyes will get out of there. Same with the runny nose. And also a way of activating other parts of the immune system to go in there and fight. So that's kind of an overview of the allergic response.
Okay. So now there's all kinds of, as I mentioned, there's all kinds of allergies. From food allergies, I think, are the most common. We hear about peanut, milk, and shellfish allergies that can actually be life-threatening.
Yeah.
So let's start with the food allergies and how you treat them, or how you even know that you are allergic to them.
Right. Well, as far as peanut and shellfish, they are incredibly common, and people will have a pretty immediate response certainly within a couple of hours of eating something, let's say peanut butter. Within a few minutes even, the person will start turning red, getting itchy, sneezing, even dropping their blood pressure, wheezing, having shortness of breath. And those can, like you said, be life-threatening. So if the person identifies that, then they must really avoid those foods and be prepared with something called an EpiPen, which is epinephrine, which you can inject, or just having Benadryl available for those times when you accidentally ingest something.
Okay. Now, okay, so you talked about peanut and
shellfish. As far as milk, yeah. There's milk allergy and milk intolerance. Now, milk allergy tends to present in little babies where, you know, they're being given formula with milk products in it, and they start to get diarrhea, break out in bad skin rashes, and sometimes they'll have nasal congestion and wheezing also. But it tends to come in young children. Then we have older people who sort of develop milk intolerance, where they're having a different kind of immune system reaction, where it's not immediate, it's more delayed, and they're getting bloating, abdominal cramps, a lot of gas and stuff like that. And that one's more just an intolerance, especially to lactose. Okay. So those are kind of different.
So they should just avoid it.
They just avoid it.
Okay. Now, then there's also the seasonal allergies.
Yeah.
And I mean, there's all kinds of things. I don't even know how you would know what you're allergic to. Grass, weeds, trees, pollen, molds. I know even this time of year we see those gnats coming around again.
That's true.
And those, like my husband is horribly allergic to them.
Yes.
Why are they so potent, I guess is the word?
Well, insects, you know, can really create havoc with us, from a mosquito bite to a bee sting to gnats. Yeah, so those would be the more immediate reactions. And the things that interact with our mucous membranes, that would be, you know, the inside of our mouth, our nose, the lining of our eye. There's a really rapid reaction that occurs there. Mm-hmm. So if something gets into your eye, you're going to start watering very, very rapidly and itching, whereas somewhere else on your body that might not happen from a gnat. But back to the question of how do you identify what you're allergic to, it's very difficult sometimes. On Guam, we don't have an allergist. It's a subspecialty of medicine. It's available in other parts of the United States and Philippines and so on, where they can do testing. What they do is they can do a blood test, but that's just sort of a general thing. the best test is what's called a pinprick or a RAS test, where they scratch test, I mean, where they basically take little pinpricks with tiny, tiny little bits of the allergen. That would be like the cockroach dust or the bee or the pollen or whatever grasses and so on, and then put teeny, teeny, teeny little bits into your skin, and then wait, and you'll have a reaction within about 24, 48 hours. It'll get really red and itchy. So then they go and read, okay, out of these 200 things that we poked you with, you're allergic to this 20. And that's available for food allergies also, and it's very, very helpful. But it's something you have to travel off island for.
I was going to say, yeah, it's not available here.
Yeah.
So for those people who don't have it here, what's the fastest way to treat seasonal allergies or insect allergies?
Right. So here's the thing. Even if you get tested and you find out what you're allergic to, you may not be able to avoid it. How can you avoid grass and trees? So in the end, you end up needing to take that antihistamine. So at least you know what you're allergic to, but you're going to have to take medication preventively pretty much every day if you're in an environment that triggers you. Something like Claritin over the counter is really effective. And as far as for the gnats, there are some eye drops, Nafcon or whatever allergy drops that you can buy over the counter that will help your symptoms, especially in a seasonal matter. You know that right now this is not time. I'm going to put the drops in and take my Claritin for the next 2-3 weeks.
Okay. Now before we head into the break, how do you treat a major allergy attack? You were talking about the EpiPen.
Yeah. So sometimes, we'll see, for example, a child that has had peanut butter and they're allergic to it, and very suddenly they'll turn red again and have the wheezing and the shortness of breath and have a hard time breathing, especially. So for that, we give them an injection of adrenaline. Adrenaline is like the fight or flight response hormone, okay? And we give them a shot of that, and then usually some steroid medication and Benadryl, and it usually will get better very quickly. But you must know that about 10% of people will have a rebound later, about 24 hours later, so they have to be watched. But those parents who know their child has an allergy, or if you yourself have an allergy, let's say to bee stings or whatever, you can carry your own adrenaline shot in a little pen. It's really simple to use. You just undo it, and then it's got a little trigger. You just
poke yourself with it.
Poke yourself, and you get the medication.
And is that something you can get over the counter, or your doctor prescribes it?
No, it's a prescription, but it's not difficult to obtain. Okay. And if you know you have that, it can be life-saving for you.
All right. And well, lastly, what are nasal polyps, and what are symptoms and treatment?
Okay. So that kind of goes along with the environmental allergies. If you're a person who's allergic, let's say, to grasses, and you're walking around, you're constantly inhaling, little pieces of grass and dust and pollen and so on, your nasal passages are always inflamed, and in response to that, they'll create what's called a polyp, and that's a little bump that kind of sticks out, and it's large, and it kind of blocks your breathing, so people feel like they have something in there. They can't breathe clearly through one nostril, and they also may feel like they have a cold all the time, or they can't smell properly because they're basically plugged up. And nasal polyps are really common, and they can be removed by an ear, nose, and throat surgeon. Sometimes we try to shrink them down with some nasal spray, and that sometimes will work, but lots of times they have to be removed.
All right, sounds good. We will pick up our discussion on allergies when Healthy Living returns.